We're glad to have Miss Fiona Mackenzie here. She came here from England after she was introduced to us. We saw her um, about 2 to 3 weeks ago. She came here and we started her treatments right away. She has metastatic stage 4 breast cancer that was initially diagnosed in 1997. At that time, she encountered multiple conventional modalities, including surgery, hormone therapies with tamoxifen, and Remedex. Unfortunately, the cancer came back. After a few years, she encountered recurrence with more aggressive cancer that was treated this time with radiation and several chemotherapy agents that in long term was ineffective. Unfortunately, the cancer came back for 5 or 6 times, and each time chemotherapy was initiated with no success. She's here and she has started the treatment with us with alternative and complementary medicine. The treatments that she has received so far are targeted at the genetic level, changing the DNA and gene shape and controlling the oncogenes and increasing the suppressor genes activity. Also, she has received the therapies including hyperbaric oxygen and IV therapies to control the estrogen receptors. So far, she has maintained the treatments very well, and as far as are concerned, she has clinically improved. The tumor size has shrunk, and also the tumor markers have dropped. Initially, it was increased up to 62, and now it's down to 24. We're very glad, and we're continuing her treatment. She would like to also say some words about her experience in England and how she found us. Fiona.
Hi there. My name's Fiona and I've come from England. It took me a little while to find Dr. Nezami, but I'm very grateful I have because I think my life's already been extended because of that. In England, I got treated all the conventional ways. I had a mastectomy, I had chemo, I had radio. None of these things seem to last for, well, very long really. They obviously prolong my life to a degree. And I'm very grateful to having found Dr. Nezami because now I'm having treatment that makes so much more sense. It balances out my body, it gets to the root of the cause of the problem, and I find it a very clever and a very good way to tackle the cancer.
That's great to hear that. I remember when she came here, she had a big sized mass in her chest wall, penetrating from the chest wall under the skin, and which was positive in the CT and PET scan. She had multiple cancer nodules inside her CT and PET scan of the chest, and clinically she was the first one who told me that the cancer has shrunk in the sides, and after I measured it, it probably shrunk about 50% to 60% in the size. And so she was the one who actually noticed it before I re-examined her, and that's great. I would continue her treatments. We have always said that we don't discourage patients for any conventional treatments, but when a patient gets to the point that the conventional treatments, they are exhausted and the treatment is not working, then they find other routes of their treatment. And I think these treatments should be part of the standard of care and should be initiated as soon as a patient is actually diagnosed with cancer instead of waiting for so long. What do you think, Fiona?
I agree. I think it's very sad that conventional medicine runs out of options. The cancer no longer is sensitive to the chemo, and at that stage I very much felt my oncologist had put me out to grass like an old horse with no more to be done. And luckily I didn't believe that, and I set about searching, and a friend gave me Susanna Summers' book to read, and out of that I then found Burton Goldberg, who who I spoke to, and he said there's only one person I'd send you to, and that's Dr. Nezami. And that was good enough for me.
Well, that's a pleasure for us, and we hope that you will continue having excellent results in your cancer response, and we are pleased to continue being your doctor here.
Yeah. Thank you very much, Dr.
You're very
Nezami.
welcome.
Thank you.